Today we're going to go through hand hygiene and garbing. So the first thing we want to do is we're going to put on our hair cover. You want to make sure that your ears and all your hair is covered. Next, you're going to put on your surgical mask. You want to make sure it covers the bridge of your nose and is under your chin. Now, because we're on the dirty side of our anteroom, we're going to don our shoe covers while stepping over our line of demarcation. So don one, and step over. Don the second one, and step over. Now, before we get to performing the hand and forearm hygiene, I'm going to get my gown ready. So I'll just lay that out, as well as my gloves. So on the clean side of the anteroom, we're now going to go over to the sink and we're going to start our hand and forearm hygiene. The first thing that we need to do is we're going to use a nail pick to clean under our nails. That only has to be done once a day, the first time you do your hand and forearm hygiene. So I'm just going to turn on the water. My nail pick, I'm going to clean under my nails under the running water. And you're going to dispose of it as per site procedure, so that could be a sharp container of garbage. Now you're going to wet your hands and your forearms, and you want to try and keep your fingers pointed up. You're going to apply your antimicrobial detergent, starting with your palms, then the back of your hands, your fingernails, in between your fingers, so interlocking, and your thumb starting at the base of your thumb. Now you're going to wash wrist to elbow. This whole procedure of hand washing you want to do for a minimum of 30 seconds. As per NAPRA's model standards for hand hygiene and garbing. And then repeat on the other arm, starting at the wrist and working down towards your elbows. You're then going to rinse again with fingers pointing up, and you want to avoid touching the sink. If your hands were to touch the faucet, you would need to repeat the hand hygiene process again. When that's complete, you're gonna take a low lint towel and you're gonna pat dry, starting at your fingers and working down towards your elbows. And you wanna make sure you thoroughly pat dry your hands and forearms. Now, because this sink, I have to turn the taps off, it doesn't automatically tap off, I'm gonna use my towel to turn off the taps. I'm now ready to apply the alcohol-based hand rub to my hands. So the first thing I'm gonna do is I'm gonna squirt a bunch into my palm of one hand, dip my fingers in for a few seconds, and now apply the ABRH starting at the wrist, down my forearm towards my elbow. And I'm gonna repeat the process with my other hand. So again, a couple pumps of the ABRH, dip my fingers in for a couple of seconds, and then apply it to my forearms again, starting at the wrist and working down towards the elbow. Now I just have to let it dry before I can apply my gown. Again, you don't want to make any sudden movements when you're with your hands, so you just have to let it dry. So now that my forearms are dry, I'm going to apply my gown. And it ties at the back. And before I don my gloves, I'm gonna put some more alcohol-based hand rub in my hands. Just like washing, it'll be palms, back of the hands. Because we dipped our fingernails in, we don't have to do our fingernails, so you're just gonna interlock your fingers. And then your thumbs, again, starting at the base of your thumb. And again, you wanna allow it to dry before you don your gloves. Your gloves will not go on properly if you do not let the alcohol dry. And again, don't make any sudden movements with your hands. So once it's dry, to don your glove, you can place a finger on your opposite hand onto the outside of the glove. You don't pull the cuffs up of your glove quite yet. And then to don the other glove, you're just gonna slip your fingers inside your glove, stick your other hand inside. Now you'll pull the glove over top the cuff of your gown, and then repeat on the other side. Now you're ready to start compounding.